I'm Dave.
And I'm Neil.
And we're excited to be answering your most frequently asked cannabis questions.
We'll be doing this through a series of quick, digestible Q&As with some of the most interesting characters in the cannabis space and the broader culture at large.
Today, we're spending 420 seconds with Danny Minogue. Danny once had a long career in various sales and marketing roles with a little-known pharmaceutical company called AstraZeneca. After a routine company restructure, Danny decided to take his skills, transition to greener pastures, and follow his passion into the newly legalised medical cannabis market. He started with Althea Group Holdings in 2018 and held a number of sales roles, including working with prescribers and helping to educate doctors to establish medical cannabis advocates within the medical community. More recently, he's taken up a role heading up business development at Cann Group, who are an Australian GMP cultivator and manufacturer. Cann Group currently manufacture GMP medical cannabis for the local and international markets. Danny is passionate about breaking down stigma associated with cannabis and celebrates the local cannabis industry, bringing GMP medicines to patients.
Danny, thanks for your time.
Hey guys, good to see you again.
Likewise. So, mate, a bit of an exciting one today. One of the biggest topics in the domestic market at the moment is street product versus legal medicinal cannabis. And specifically looking at three metrics. One, price, which traditionally black market has had the advantage with. Two would be consistency, where we know medicinal cannabis probably reigns supreme. And then, of course, there's a hot topic of quality, which is better there. So taking it to the top with price, how would you categorize the difference between the two traditionally and what's emerging?
Well, look, one of the challenges, I guess, Dave, is that the amount of testing, quality control, etc., that goes into the cultivation of medicinal cannabis has meant that it will be a more expensive proposition. So probably wasn't that long ago, when it first came online 2 or 3 years ago, patients would have been spending, anywhere around $30, $35 per gram. The volumes that people were selling were quite small. And as a result, the cost was really high. So I don't think many people purchasing on the street would have been paying anywhere near those quantities. Most people are probably be paying, $10, $15, $20 per gram at most when they're getting it through the street market. So that was a real challenge for a lot of people. It was just too expensive, Now, as supply chains have gotten better and the demand has increased and there are more patients utilising particularly flower, the price has come down a lot. So I think today, as we see it, a lot of the products on the market for medicinal options, are around that $15 a gram mark is probably about average. So it's getting a hell of a lot closer to what patients would be buying if they sourced it through an illicit channel.
Yeah, and we are starting to see that, and it's great for patients, but also good for people who are going through the illicit market but want to transition to a medical space, because that price prohibitiveness has really been a problem. Is the price coming down any indication of the consistency or of the quality of the product at all?
Oh, and I think it's a result of the competitive nature of the market. So there's certainly more and more companies that are offering, dried flower options for patients. There are greater quantities of the product, both grown locally but also imported. So I think that competitiveness and also companies are probably getting to a size where they've got some scale. And as a result, things are naturally going to be a bit cheaper. So I think that's what's happened to occur to get to this point. For a lot of patients, particularly if they've been buying from the street, still probably not quite cheap enough for them, Neil, if I'm honest. But, as there are companies like Elevated Extracts that are coming around and bringing products that are now going to be $10 a gram. I think that's really kind of hit that critical mass where I don't think there are too many patients out there sourcing off the illicit market that are getting a quality product for cheaper than $10 a gram. So I think we've got that meeting between quality and price, but why would you continue sourcing an illicit product when a legal, safe option is the same price or even cheaper?
Yeah, absolutely. And it's probably a good point just to remind people, whether they're on the imperial or the metric system, that an ounce is approximately 28 grams. So if they want to extrapolate that kind of $10 a gram price point that's now starting to hit the medicinal market, they'll start getting an idea of what they're paying for sure. So yeah, I guess with that, looking at the quality side of things, there is a plethora of different strains out there, and people are becoming more particular with what strains they have. A lot of people, a lot of patients, I should say, do seem surprised that there is actual traditional strains available in the medicinal market. What can you tell us about the nuance between those strains and the quality that's kind of assured with them when grown in controlled environments like medicinal cannabis plants?
Sure. Yeah, well, there are certainly lots of, I guess, the mainstream genetics that people would be familiar with. You know, there are the majority of companies have gained access to those genetics. And as a result, there are products on the market with genetic lines of things like Northern Lights and Sweet Skunk and Royal Moby, just to name a couple of them. So I think there's some familiarity from patients who have maybe been using illicit cannabis for a number of years, that they can still access some of those genetics. But I think the point you mentioned was really around the quality associated. And I think when these products are grown under controlled conditions, they are grown in ways where they utilize mother plants and things like that. There is a high level of consistency from both the THC or the active ingredient side of things, but also around, you know, the terpene profile as well. So things like that, which play a role in the impact it can have on patients. And we're seeing them grown in conditions that allow that to be replicated. And as a result, patients acquiring, you know, a product from a month to month to month should see that consistency that they can expect. And many are frustrated by the street market, whereby it's that consistency that's not present, that they can get perhaps a high THC product 1 month, and the next month it's a very low THC product that's sold to them under the same one and the same.
No, definitely, and we do hear some of those gripes as well. For those patients or for those users that are currently using illicitly and want to transfer to the medical space, what does that look like in terms of the access pathways, and what would a patient need to think about in order to take that step?
So again, that's where we've made a lot of improvements over the years, Neil. So it's been tricky to find a doctor that's being open-minded enough to approach medicinal cannabis, you know, in a balanced way. I think the medical community is taking that on board, and there are more and more doctors, both located in specialist medicinal cannabis clinics, but also in just everyday medical centres, that see this as being, you know, for some patients, part of their holistic treatment. So I think the first part, Neil, is to chat to a doctor, you know, ideally your own doctor, but if they're not open with it or not comfortable enough, you know, there are a lot of telehealth platforms out there. There are a lot of specialist clinics that are there to fill that void. So, you know, again, Canwell's another telehealth platform that people can just go and make an online booking, talk to a doctor, and gain a script to access medicinal cannabis and source it legally, you know. So I think that has become really quite simple now. And the cost associated with particularly the clinics has come down dramatically. So it's an affordable way for most people to access medicinal cannabis. Once they get their approval from their doctor, again, the recent TGA change meant that, you know, patients can access any dried flower product from one approval. So that's dramatically been simplified. And then once their doctor has chosen them a product and got the appropriate approval, they just go to a pharmacy and source it from a pharmacy. So it's getting more and more streamlined, and it's a lot quicker, and it's a lot easier than it's ever been before.
I mean, it makes for a pretty exciting 2022, to be honest. And look, with, I guess, all due respect to the history of the plant, we do acknowledge there is some great product available on the black market, also we've heard. But the reality is, I think most people would empathize that it is very inconsistent, and you just do not know what you're getting. And of course, there is the legal element to it as well. So with that said, I mean, it's very exciting to know that we have high quality products, consistent, you know what you're getting, and you can actually read what that terpene profile is and really know it. And of course, the cherry on top is that price parity between the black market now, making equal access for all Australians, which for us is probably the most exciting thing to be happening. And of course, to wrap that all up with access that's actually achievable for the average patient without the stress and anxiety they've had in recent years. Yeah, bring on 2022, Danny.
When you put it that way, it's a bit of a no-brainer when you put it that way, Dave, isn't it, mate?
Oh, absolutely. I think we're in a great position, and I think we might be starting to catch up with the rest of the modern world in this space. It's very exciting.
Very good, guys. Thanks for the chat.
Mate, thanks for your time. We'll speak soon.